Hello, my name is Edward Ilsley and I'm a senior physicist at Rutherford Cancer Centres. Physicists are involved in many parts of the patient's pathway, and we do a lot of the behind the scenes work to ensure that each patient's treatment is delivered accurately. So the main aspects of a radiotherapy physicist's job are probably fourfold, I would say. The first one being commissioning of new machines and techniques. So a manufacturer may produce a new piece of kit, equipment, machine, whatever, or a pioneering centre may develop a new technique that is found to be more efficient. We will then take that technique or product and implement it in the clinic, by which we'll have to do a series of experiments to determine the optimal way to commission it safely for the patient. In addition to commissioning, we also perform a lot of machine quality assurance. So this is periodic testing of the machines to ensure that from the time of commissioning right through the lifetime of the machine, they continue to function as required, and thus the patient's treatments are delivered as expected. Physicists are also very involved in the treatment planning process. So each individual patient has a CT scan when they first come into the centre, and that CT scan will be used to tailor a radiotherapy or proton therapy treatment specific to that patient's needs. So physicists will work very closely with the dosimetrists to produce the treatment plan, and it's a collaborative effort with the clinicians, so those are the clinical oncologists, and altogether we can come up with the optimal solution. The final aspect of our job is research. So radiotherapy is a continually changing field, and we're always looking to find what works and what doesn't, what's the best technique to use, and a lot of the research is involved in adjusting the technique slightly and then identifying whether that has had a beneficial effect on the patient's treatment outcome. If you're interested in becoming a radiotherapy physicist, I would say the first stage is to do a physics undergraduate degree, and if you find there that radiation physics is for you, then you can, after your degree, you can specialise in medical physics. And once you start your clinical training, normally with a hospital, you'll enter various different parts of medical physics, nuclear medicine, radiation protection and radiotherapy physics, and then you can choose which is for you, and well, for me it was radiotherapy physics.